My name is Dr. Lorraine Dickey, and I am the founder and CEO of the Narrative Initiative. At the Narrative Initiative, we use the stories of healthcare professionals to narrow the gaps in staff expectations of giving care, to narrow the gaps in patient expectations of receiving care, and the communication gap between what healthcare providers say and what patients actually hear. It is important to appreciate all of these gaps get wider when a patient perceives a lack of kindness. Over the past 15 years, our research has taught us the key to kindness in healthcare is to be perceived as being kind by the receiver of the intended kindness. Have you ever done something for someone with the intention of being kind, only to have it backfire? I know I have. Let me give you an example. Let's say I'm walking into a store. In front of me, there's a gentleman in a wheelchair who is trying to open the door. And he seems like he's having trouble. What's my first reaction? To open the door for him. Now imagine this scenario. He looks up at me and he says, "Thanks, I appreciate the help, but I've only been in this chair about 2 weeks and I've got to learn to do this for myself." So now how do I feel about that big? Now what could I have done differently so what I intended was in fact received as a kind act? I could have asked. I could have asked if he needed help opening the door. So what difference does it make? First, asking allows him to make a decision about whether or not he wants to be helped based on his own culture, his own values. This allows him the chance to either opt in to receive the kindness that I want to extend or to decline it. The ask also allows him to feel whole and valued as a person with an opinion that matters, instead of feeling less than whole, as a person who needs somebody else's assistance to get by. So the key to offering a kindness and to being perceived as being kind is the ask. Getting permission to act kindly. At the Narrative Initiative, we say it's all about the ask. Remember, we as healthcare professionals opted into this line of work, and we want to give care. This is not always true for patients who may not want to be in the position of needing to be cared for. They need the chance to say it's all right with them for you to take care of them. This upholds their dignity, it's respectful, and it's kind. Staff members who work with our Narrative Kindness Initiative tell us they leave with a heightened awareness of how to be perceived as being kind. They gain empathic listening and reflection skills that they can use both in their professional and personal lives. And they leave feeling decompressed, supported, and validated through the sharing of their stories with peers. If you and your organization are interested in bringing kindness into the experience of caring for patients, schedule a call with us. We can help. We look forward to hearing from you.